Graft-versus-host disease is a disease that affects people who have already had a bone marrow transplant. And what it entails is the graft, the marrow or stem cells that are grafted into the patient who has the disease, they essentially turn against the host, meaning the person who has the disease. And because those cells go everywhere in the body, they can essentially affect all the different organs and areas of the disease. There's two types of graft-versus-host disease: acute graft-versus-host disease, which generally occurs almost immediately after transplantation, and then there's chronic graft-versus-host disease, which usually occurs a couple months later, but can occur even years later. Chronic graft-versus-host disease can present with a variety of different manifestations, as it can affect various organs. Probably the most common one is the skin, and there can be different types of manifestations there. One can have thickening or development of scars in the skin. It can be an erythematous or really red rash. The skin can actually fall off. They can also have issues with their mouth, where they lose the lining of their mouth, they develop ulcers. They can develop problems with their eyes, not only just dryness, but they can attack their corneas as well. Blindness is even seen. Then the same things that affect inside their mouth can affect their intestinal system as well. So they get breakdown of the intestinal walls and stomach. Their liver can be affected as well. They sometimes have issues with movement because of the changes in their skin and in the tendons and the other tissues inside. They're not able to move their limbs or walk. It can be very difficult. So there's just a large variety of ways that it can impact the patient, but essentially it severely impacts their quality of life and what they're really able to do. These patients have already been through a lot, right? They've already had chemo, failed that, had a bone marrow transplant, and now, though maybe their disease is gone, they now have yet another disease. So I think I've said they're trading one disease for another. And there's just a lot of morbidity associated with chronic GvHD. So if you could prevent that, it would allow them to get out from the transplant and essentially, move on with their lives. So I think that to me is the most attractive thing. Always, prevention is always what we'd like to do. And if we, as the program develops, if we can show that, that this will prevent GvHD, I think that would be a major accomplishment. I personally have an interest in diseases that are underserved or an unmet need, and there's really nothing in chronic GvHD. So when that issue was brought up, I really jumped at the opportunity to really be involved in the program and bring that forward. Plus, I'm a pediatrician, so the fact that we could bring this to children, and I'd seen what this disease had done to children, that was also very attractive to me.